Ladies, there is something important you need to hear. And while it may be uncomfortable, knowing it could completely change how you feel the next time you step into a doctor's office. Over the years, countless older women have shared stories of being misunderstood, overlooked, or treated with less respect than they deserve in medical settings. Today, we're going to pull back the curtain. What truly goes through a doctor's mind when an older woman walks in? What are the quiet conversations happening where patients can't hear? And why do certain dangerous assumptions put your health and even your life at risk? Stay with me until the end, because I will reveal one powerful warning sign, a single phrase that often means your concerns are not being taken seriously. But first, like this video, subscribe, and share your experience. Have you ever felt a doctor dismiss your words? I'd love to hear your story. Part 1. They assume you're just old. This is one of the most harmful assumptions older women face in the medical world. The moment you step into an exam room, some doctors automatically view every word, every symptom, through a single narrow lens. She's just old. As if that's all there is to know. As if that alone is the diagnosis. End of story. You say your knees ache, and they respond, it's arthritis. You mention feeling worn out day after day, and they shrug. That's just part of aging. You admit your memory seems a little off, and they wave it away. It happens to everyone at your age. Those blanket statements might sound harmless, but in reality, they can be dangerous. Why? Because they lead to neglect. I've watched bright, active older women walk in with serious medical concerns, only to have them brushed aside with a half smile and a comment like, well, that's to be expected. But here's what rarely gets said out loud. Age is not a diagnosis. Yes, it's a factor, but it's never a valid excuse to ignore red flags. Take Margaret. For example, a woman in her late 60s, she arrived at a clinic complaining of chest pressure, queasiness, and lightheadedness. The first doctor told her it was probably indigestion and suggested she watch what she ate. But Margaret trusted her instincts. She knew something was off. She kept asking for more tests until another physician finally ordered an EKG. The results revealed she had been experiencing repeated small heart events. Without persistence, she could have lost her life. If she had accepted the first dismissive answer, her story might have ended in tragedy. This mindset that symptoms don't matter simply because they're coming from an older body is not only ageist, it's dangerous. Persistent fatigue could signal heart trouble. Changes in memory might be related to a vitamin deficiency or the early stages of dementia. Joint pain could be linked to autoimmune disease. Pain is not a personality trait, and it's not something to just live with because you're past 65. Yet the moment your age is revealed, some doctors quietly downgrade the urgency of your complaint. It's almost like there's an unspoken rule. You've had a good life. What more do you need? That kind of thinking is unacceptable. Your life, your comfort, your mental clarity, they still matter. They matter deeply. No matter how many birthdays you've had, if your doctor isn't willing to treat your symptoms with the same seriousness they would offer a younger patient, it's time to find one who will. Because sometimes it's not just old age. Sometimes it's something real, something treatable, and it will never be discovered if no one takes the time to look. Part 2, they think you're not tech savvy, so they don't explain. Let's talk about another deep-rooted bias that quietly shapes the way many older women are treated in medical settings. Far too often, the assumption is made that you don't understand technology, and from that single assumption, a chain of decisions begins, decisions that leave you with less information, less clarity, and sometimes less control over your own health. If a doctor assumes you can't manage complex instructions or grasp the details of a modern treatment plan, they often stop explaining altogether. Instead of walking you through the medication name, what it's meant to do, potential side effects, and why it's being prescribed, they might simply say, Take this twice a day and move on. No context, no education, just an order. It's a pattern I've seen more times than I can count, and it's frustrating. Imagine asking, what exactly does this medication do, and being waved off with, oh, it's just something for your blood pressure. As if that's enough to fully inform you. Would they respond that way to a 35-year-old patient? Most likely not. The reality is, many older women are more than capable of managing technology in their daily lives. Some can coordinate schedules, handle finances, research health information, and navigate multiple apps with ease. But outdated thinking persists that once you pass 65, you must not own a smartphone, know how to log into a patient portal, or be able to keep track of a multi-step care plan. Because of that false belief, some doctors take over your decisions. They simplify instructions to the point of being vague or even useless. They skip sending follow-up notes, rush through explanations, and fail to check whether you truly understand what's been discussed, the outcome. You leave the appointment feeling uncertain. You try to recall what was said, but the conversation was rushed and scattered. You hesitate to call back because the tone they used made you feel you wouldn't understand anyway. This can lead to missing doses, taking the wrong amount, or experiencing side effects you're unsure how to handle. And then unbelievably, you get blamed for not following instructions. But here's the truth. The real failure happened when they didn't respect you enough to give a proper explanation in the first place. Medical knowledge should never be kept from you, and it should never be oversimplified to the point where it loses value. You are capable, you are intelligent, and you have every right to know exactly what's happening with your body. So, the next time a doctor talks down to you or skips the details, speak up. Say, I'd like to understand this completely. Don't let them rush you. Don't let them assume. You deserve clear, thorough explanations, not just vague instructions. Part 3, they underestimate your pain. This issue strikes a deep chord because it's tied to a long, troubling pattern in medicine, one where women's pain is too often dismissed. For decades, outdated ideas have painted women as overly emotional, prone to exaggeration, or simply too sensitive. And when it comes to older women, this bias doesn't just remain, it intensifies. I've heard countless stories of women in their 70s or 80s describing severe, life-limiting pain, only to be met with a quick glance and a casual, "We'll keep an eye on it." That phrase is often a silent code for, "I don't believe you." Or worse, "You're too old to address this anyway." That kind of thinking is unacceptable. Pain is not a weakness. It is not a natural burden of aging that you must simply endure. Yet, many doctors operate on the assumption that if you're older, you've grown used to discomfort, and if you're speaking up, it can't be all that bad. Consider the story of Eleanor, a 75-year-old woman who still loved tending her garden and taking daily walks. One day, she began experiencing sharp, persistent pain in her hips and lower pelvis. Her doctor brushed it off, saying it was likely arthritis and that everyone your age has it. There was no imaging, no diagnostic tests, no referral to a specialist. 3 months later, still in agony, Eleanor sought a second opinion. This time, scans were ordered immediately. The truth, she had a fractured pelvis that had worsened as she continued walking on it. The injury was real, serious, and preventable if only it had been taken seriously from the start. Sadly, Eleanor's story is far from unique. Another woman endured months of constant abdominal pain. Each time she sought help, she was told it was probably constipation. Only after persistent requests for more thorough testing did someone finally investigate, properly revealing advanced ovarian cancer. Could earlier detection have changed the outcome? We can't know for sure. But the delay cost her dearly. The lesson is clear: as you age, your pain may be more complex. but it is still valid and it demands the same urgency as anyone else's. If your doctor doesn't seem to take it seriously, doesn't ask follow-up questions, doesn't offer concrete next steps, or acts as if they doubt you, walk away. Find someone who will listen. You know your body better than anyone else. You know what feels normal and what feels wrong. Neither your age nor your gender should ever be used as a reason to ignore your suffering. Part 4, they assume you're not sexually active, so they skip important screenings. This next point may surprise you or even make you angry, but it needs to be addressed openly. Far too many doctors, particularly male physicians, cling to an outdated and completely false belief that once a woman reaches her 60s, she is no longer sexually active, that her romantic or physical life simply fades away. Because of this false assumption, the conversation often stops before it even starts. Doctors don't ask questions about intimacy. They don't check in to see how things are going. And they skip screenings or treatments that could dramatically impact your comfort, health, and quality of life. The reality is very different. Many older women continue to have fulfilling intimate lives. Some remain in long-term marriages. Others begin dating again after a divorce or the loss of a spouse. Some even discover new dimensions of their sexuality later in life. But to a doctor who believes intimacy vanishes after menopause, none of this matters. And the consequences are serious. Important tests for sexually transmitted infections are left undone. Questions about discomfort during intimacy are never asked. Pelvic exams are overlooked. Topics like vaginal dryness, tissue thinning, or hormonal changes are ignored, either because they're seen as irrelevant or because the doctor feels awkward discussing them. That silence comes at a cost. Consider the experience of Marion, a 69-year-old widow who began a new relationship after years of being on her own. She was excited, nervous, and rediscovering a part of herself she thought she had lost. But after several months, she developed pain and bleeding during intimacy. When she brought it up to her doctor, he brushed it off, saying, "That's just what happens with age. Nothing to worry about." He didn't examine her. He didn't ask follow-up questions. 6 months later, Marion sought another opinion. Feeling frustrated and concerned, this time, a proper examination revealed untreated infections, significant vaginal atrophy, and early signs of tissue breakdown, all issues that could have been addressed months earlier if her symptoms had been taken seriously. The root of this problem isn't purely medical, it's deeply cultural. Society often treats older women as though they should fade into the background, becoming invisible. But your needs, your body, and your capacity for pleasure do not disappear with age. Any healthcare provider who ignores this reality is not providing complete care. Here's the truth: if your doctor doesn't ask about your sexual health, bring it up yourself. If they seem dismissive or uncomfortable, find another provider who will respect and address your concerns. You have the right to comprehensive, respectful, age-inclusive care, and you should never feel ashamed for wanting to live fully, love deeply, and nurture every part of your well-being. Part 5, they assume you're not worth the aggressive treatment. This topic can be difficult to confront because it's where prejudice about age collides with the ethics of medicine. I've seen this scenario play out far too often. An older woman, perhaps in her 70s or 80s, comes in with a serious diagnosis. It might be cancer, a heart condition, or a problem with her lungs or kidneys. The list of potential treatments is clear: surgery, a newer medication, a more intensive plan, and yet, before she's had a chance to share her goals or preferences, the doctor says something like, "At your age, we don't usually recommend that," or "the risks probably aren't worth it now," or, even worse, "Let's just focus on keeping you comfortable." To be fair, there are cases where a gentler, less invasive approach truly is in the patient's best interest. But too often, the choice is made long before the discussion begins. The underlying assumption is that you wouldn't want to fight, that you couldn't handle potential side effects, or that your remaining years aren't valuable enough to warrant the cost, effort, or time required for aggressive care. And here's what's most troubling. These decisions are made without asking you what you want. You're denied the chance to weigh the pros and cons for yourself. That's not just poor communication, it's taking away your agency. Let me share the story of Judith, a 73-year-old woman diagnosed with breast cancer. Her physician proposed doing nothing beyond prescribing hormone tablets. There was no suggestion of surgery, no referral to an oncologist. Why? As he later admitted to her son, "She's not young. We want to keep things simple." But Judith was far from frail. She had run her own bakery for decades, kept an active social life, and had plans to travel abroad. Simple wasn't what she wanted. She wanted to live fully. When she sought out a specialist, the difference was night and day. This doctor listened, discussed every option, and ultimately recommended surgery. Judith went through with it, recovered beautifully. And today, 4 years later, she is healthy, vibrant, and still pursuing the adventures she dreamed about. That's the power of being given a choice. So let me make this clear, you are not a burden. Your life has the same worth and dignity as anyone else's. You have the right to know all of your treatment options. You have the right to decide how assertively you want to address your condition, whether your priority is to extend your life, improve your quality of life, or simply understand all the possibilities. If a doctor makes the decision for you without your voice in the conversation, they are not respecting you. They are not practicing patient-centered care. They are dismissing you, and that's not medicine. That's discrimination. Part 6. They think you're set in your ways. Let's turn to a bias that hides in plain sight, yet causes just as much harm as the more obvious ones. Many doctors, whether they will openly admit it or not, quietly assume that older women are unwilling or unable to make meaningful lifestyle changes. In their minds, once you have lived a certain number of decades, your routines around eating, movement, sleep, and mindset are set in stone. And what happens when they think this way? The conversation stops before it even begins. They do not bring up the benefits of resistance training, even though it is one of the most effective ways to keep your muscles strong and your independence intact. They skip discussions about nutrition, even if your weight has shifted or your energy has dropped. They pass over suggestions for improving sleep, boosting mental clarity, reducing inflammation, or lifting your mood. Why? Because they have already decided the answer for you. You will not change. That way of thinking is not only narrow-minded, it is lazy. I have met women well into their 80s who showed more drive than people half their age. I have seen women take up lightweight training and regain their balance, cut out processed sugar and reverse prediabetes, or start a daily journaling habit that lowered their blood pressure. When a doctor walks into the room convinced that you are fixed in your ways, they rob you of the opportunity to grow, improve, and transform. This is a subtle form of discrimination, so subtle that you might not even recognize it when it happens. But its effects are real. You are denied the tools and guidance that could help you thrive, all because of someone else's low expectations. And this attitude does not stay in one area. It spills over into everything. A younger patient might get 20 minutes of discussion about healthy habits, while an older woman gets 5 minutes and a prescription. The unspoken message is, why bother? She will not change. What they fail to see is that older women are among the most adaptable, resourceful, and determined people out there. You have raised families, built careers, endured losses, overcome illnesses, and reinvented yourself more times than most people ever will. You are not frozen in place. You are strong, and with belief, encouragement, and the right tools, you can reshape your life at any age. If your doctor does not see that truth, then they do not truly know you, and they do not deserve the privilege of caring for you. Earlier, I promised to share the one phrase that should immediately raise a red flag. Here it is, let's just keep an eye on it. If there's no clear plan, no set timeline, and no follow-up, it often means your concern has been mentally pushed aside as not urgent. You deserve clear answers, thorough testing, and a doctor who takes you seriously. Never allow vague reassurances to delay your care. Your health matters now, not later. If this message resonates with you, tap the like button, share your thoughts in the comments, subscribe for more empowering advice, and turn on notifications so you never miss the tips that could protect your well-being.